close look at yourself in the mirror. Are you noticing more and more lines and wrinkles? Should we really consider injecting a product into those wrinkles to freeze or relax them? Is that even safe? Dr. Sabrina Fabi from Cosmetic Laser Dermatology is here with a few things to consider. Thank you so much, Dr. Fabi, for coming in. We do appreciate it.
Thanks for having me, Heather.
Okay, let's talk about, there's a name for these neuromodulators. What exactly is that and what do they do?
So neuromodulators are a product that you can inject. This is a medicine that has been essentially purified that you can inject into the muscles that cause the lines when you squint from looking at your computer all day long or your iPhone or tablet all day long. And it essentially relaxes those muscles so that you don't create those permanent lines in your forehead that make you look like you're angry or upset.
Now, people always ask, especially for folks who've never done this before, is this safe? Is this a good idea?
Well, we've been injecting this for both for medical purposes since 1989 and for aesthetic purposes since 2002. And so, yes, it is safe. And so there are a couple that are approved for aesthetic use in the United States. There's actually 3 that are presently approved, and people have been using it safely now for over 13 years in the United States for aesthetic purposes.
Have you ever seen somebody have a reaction?
I have never had anyone have a reaction in my personal clinical practice, and I've been injecting the product now for actually 8 years.
Wow, okay. Now, a lot of people say, you know what, I already use a wrinkle cream. I already have this serum I slather on my face every night. Does that do the same thing?
So creams are wonderful, and as a dermatologist, I'm always going to encourage skincare. There's no substitute for it, especially to help hydrate your skin, because we start getting our skin becomes drier with age, and also for the purposes of sun protection and antioxidants. But there's nothing that's actually going to relax a wrinkle that's caused by movement. And so if your wrinkles you're noticing are coming from muscles while you move, while you squint, while you frown, then those are not things that a cream, unfortunately, as much as I would love them to, would be able to relax, at least not yet.
Not yet. Okay, then let me ask you this, what age is the right age to start doing something like this?
So more and more, we're seeing younger patients. I see a lot of patients between 25 and 30 that are coming in. Basically, the rule of thumb is if you're starting to see these wrinkles form, especially with movement, then it's probably a good time to do it. You definitely would want to prevent them from forming at rest, because once they're there at rest, it's very hard to get rid of them or erase them completely.
Now, some people may say, and we're seeing some pretty remarkable before and after pictures here, they say, you know, I have a family reunion coming up in a week, or I have a wedding that I'm going to be in a month from now. What is the right time? How do you time it perfectly where you see the results?
That's a great question. And so in most clinical trials, we usually saw a peak effect anywhere between 2 to 4 weeks. And so you want to at least probably give yourself 4 weeks before a big event, just to make sure that it takes in and they can get, you know, touched up if it's needed. But otherwise, the neuromodulators usually last 3 to 4 months. In that, about 3 to 4 months, you have about 80 to 100% full movement again.
Now, for folks that may be trying this for the first time, they may not have the most great experience. Some people get eyebrows that start darting up, or they're unhappy with the look of it.
Right.
How do you make sure, number one, you're going to the right person so you don't get that look, and what do you do if you end up looking frozen?
Okay, so as with anything, there's side effects from medications, right? Even some of the over-the-counter medications that we take. And so some common side effects do include a little bruising, an injection site reaction, and you're right, even a little bit of drooping or heaviness of the brow. And so I think that's the important thing in selecting the right provider. Choosing perhaps a board-certified dermatologist, plastic surgeon, facial plastic surgeon, or oculoplastic surgeon, because these are people that go through rigorous training in order to perform these procedures. And then, of course, they usually have the experience to know how much to inject, because a lot of these reactions or side effects are classically dose dependent and injection site dependent, so where it was placed. And so you can probably rest assured that you're going to have less of those side effects if you go to the right person that's qualified to perform your injections.
Okay, and then if you do end up looking frozen and you had an unintended consequence here, is there anything you can do to relax it?
Well, the good news is that if you look frozen, hopefully you'd prevent it altogether by injecting less at your first visit. But if perhaps if you do end up looking frozen, you can always rest assured that it is going to wear off. So classically at about a month, you see less movement. You see some of that movement already coming back, and so that's great. And if you have a weird eyebrow, you can always correct it by going back to your provider and having them inject a certain muscle to relax that.
There you go. All right, Dr. Sabrina Fabi, thank you so much for joining us this morning. All the information is at the website, which is right there at the bottom of your screen if you have any questions and are deciding if this is right for you. And don't think it's just women who are doing this. A lot of guys, too.
A lot of men are doing this, too.
I knew it.
Absolutely.
All right, coming up, hit the